So here's another tip for all my new nurses. When I started out as a new nurse, I was in an orthopedic floor, so I had a lot of patients that were getting up for the first time and they were experiencing hypotension. A lot of my PCAs were calling out, "Hey Leah, we have low blood pressure," and I'd be like, "Oh, I need to call the doctor." Well, there are several things you need to do before you call the doctor just to ensure that that actual blood pressure is accurate. Okay, so we're going to go through a few things to try to help you. So the first and foremost thing is you're going to go and assess that patient. So whatever you get, if a PCA calls out, go and assess that patient to see if they're symptomatic, right? Maybe some lightheadedness, some dizziness, and then if they're standing up, you want to sit them down. But the next thing you want to do is you want to verify the cuff size, because a lot of times if you have a cuff size, the BP cuff can be too small, so you'll get a high reading, or it'll be too large and it's a low reading. So make sure the cuff is accurate. If it is not, change it and take it again. The next thing that you need to do is you need to take the blood pressure in both arms, so right or left. If they have a limb precaution, of course you're not going to do that, but check it in both arms and you always record the reading that is the highest. Okay, next, if that's still giving you a low pressure, you want to get a manual. A manual is always accurate. It's the first skill, I think. For me, it was the first nursing skill that I learned when I was in nursing school. So automatic cuffs can sometimes give you false lows, so always good to get a manual. And you also go with that. If it's still low, then you should reach out to the doctor. But the last thing, you should always check, specifically if you are working night shift. You get a lot of PCAs who are taking blood pressures in patients when they're laying down. You want to make sure when that patient is getting their blood pressure that they're standing up. So check it standing up. If you have done all these things and that patient is still hypotensive, then you need to reach out to the doctor for intervention. So yeah, I hope this helps the next time you encounter a patient having a low blood pressure.